Hello, my name is Jonas Moreno and I am a graduate TA for AMP1. I hope you guys have enjoyed your spring break and are ready to get back into the game. So this video will cover proper terminology of human movement, particularly the movement that happens at the head, the neck, and the trunk, since those are the muscles that we're going to be covering in the first week. I'm also going to show you guys useful tips to get around the table with all the muscles, name, action, and origin, insertion, and nerve. And then this will be provided to you for the next 3 weeks. Lastly, additional sources like Pod 3.1. I will show you guys a few things in the website. We're also going to start using Anamach in the lab, and then remind you guys that visible body is like your best friend right now. You may actually get around it, and for the next semester as well for AMP2. So proper terminology is important. You all become familiar with the proper terminology of human movement. To me, perhaps this is one of the most relevant things to learn or you get out of all the material, because it is very applicable to different areas like the health science, like biomechanics, my passion or topic of interest, and also apply health science like PA or physical therapy or OT and even nursing. For example, having a strong foundation of proper description of human movement is going to allow you guys to really understand how to treat patients during physical rehabilitation sessions. With that in mind, I'll jump right into the different actions that can happen at the head. First, I like to start off with flexion. Strictly speaking, flexion is any movement that decreases the angle between two bones. In this case, we can talk about not necessarily the head, but an easy example that everybody can relate and remember is of elbow flexion, and that's actually just moving the forearm back to the shoulder or up to the shoulder, and that's going to cause a decrease in angle in the elbow. The next thing would be extension, and it's basically the opposite to flexion, increasing the angle from between two bones. You can continue thinking in terms of elbow. If I'm flexing the elbow, I can extend the elbow as well. And then I like to point out that we also have hyperextension. This does not happen in all the joints. There are only a few joints that can do hyperextension, like the hip, and the head, and also the wrist. So here we have head flexion to the front, and then bring it back to an anatomical position will be extension. And then you can also do a hyperextension if you move your head back towards your back. Similarly, we can see that on the hip. The hip can hyperextend, and then same with wrist. The next few things that I like to point out, or the next few human movements, is left and right rotation. That happens at the head and is basically when you move your head one side to the other and you say no to somebody, for example. Then we also have lateral flexion, and that can be broken down into two. The neck lateral flexion, which is shown in this picture here, is when you move your ear close to your shoulder to one side or the other. And then also the trunk, that is when you move your upper body to the left or the right. And then we have retraction, which is moving structures posteriorly out of the anatomical position, like when the mandible is moved to the back. And then we also have the opposite, which is protraction, and that is moving the structure, or in this case, the mandible, to the front. We also have depression, lowers the bone, like when you lower your mandible bone to take a bite out of your food. And the opposite of that will be elevation. So here you have a few pictures. Retraction will be moving your jaw to the back, and then protraction to the front this way, and then depression moving it down, and elevation moving it back up. Okay. Simple. These are a few of the movements that you guys are going to be learning throughout this week, and it's important to keep them in mind because you're going to be seeing these names, this terminology in your table when you're looking at the muscle name and function. Okay. So the next thing I like to talk about is a table. So this is a picture of the table. This is one page of the table and is the first page. As you can see, we have muscle, origin, insertion, nerve, and function. Although there is a lot of information in this table, all you have to really worry about is muscle name and muscle function. These are the two things that you're going to be asked during the lab practical, so we're really just only concerned about you learning those two things, muscle name and muscle function or muscle action. Okay. Then I'd like to really focus on the details of the table. It's important that you look at the heading. The heading tells you where you're going to be looking in the models. In this case, it's going to be the head, and you're looking at the front part of the head. And then if you actually look right below the heading, you see that it says superficial, and then in parentheses you have superior to inferior. And for that, I'm going to point out some of the muscles that you can see on the table and focusing on just this part. So we have the epicranius, that will be here, up here, the frontal belly. And then right below it, inferior to that, will be the orbicularis oculi. As you can see here, that's the one next in line. And then we have the zygomaticus minor is actually this guy here. So in the table here, there's sort of like a misorder. So if I were the one really picky about it, I will probably put the minor on top and major on the bottom so that I can remember that this is a minor, this is a major, and then the next one that will be the masseter here, and then lastly orbicularis oris. So as you can see, the table gives you not only the orientation, but also the order that you're going to look at the model. So from top to bottom, again, that's the entire route of how you can look or navigate those muscles. Notice that I actually didn't talk about the next one here because before I actually can move into the bastinator, I will have to move, or better say remove some of the muscles that we have here. And for that, I actually have another picture. And sorry, it's also important to keep in mind the details. So here is telling me that it's a dip muscle. So I need to remove at least one of these muscles to be able to access to the bastinator. In this case, as you can see here's the picture we have removed, or the picture has no longer a masseter that will be covering this area here. And with that, we can actually see the bastinator, which is a deeper layer, or sorry, a deeper muscle. Moving on, the lateral side of the head has a temporalis, and that can be seen here. And then the posterior, it doesn't, you can't really see it here. You kind of see it here in the back here, but it's really just the back of the head. So as you can see, it will tell you where you should be looking in the model. And it's also applicable for the anamage and perhaps even the visible body. That's what I have to say for this. So let me actually show you guys a few things about anamage. I'm sorry, PAL 3.1. So here, if you go to anatomical models, you can go to the muscular system. And then you can, right now we're actually just working on head and neck, head, neck, and trunk, sorry. And here if we click, we are going to have a few pictures and you can interact with them. The mentalis, orbicularis, oris, masseter. And if you see here, there's a little video or a link to a video. So you can click this and it will pop out a video here. Okay. The video has details of origin, insertion, nerve, and action. They're very, very short. They're only 24 seconds, so they're really, really good tools to get around the muscles. And in addition to this material, you are also going to have access to Animage during the lab time. Make sure that you, if your graduate TA has not gone into the details about how to use it, I'm sure they will get around it. And if not, feel free to ask them to teach you how to use it. But I will expect, or sorry, not expect, but I suspect that all of us will go over how to use Animage and make it available for you guys. And also, remember, visible body is there. You can use that to your advantage. And we actually have some iPads that you guys can use during your lab hours. And I'm not so sure open lab hours, but that's something that maybe it will be available for you guys. In the meantime, iPads are available during regular live sessions, and that's for you guys to use during your study time in the lab. With that, that's all I have to say, and thank you for your time.